Recall from the example in the last video, your team is trying to reduce patient wait times. As part of the model for improvement, you brainstormed several potential solutions and put them on the key driver diagram. Now, we'll explore how the elements of the PDSA cycle help us implement those ideas. Specifically, we'll focus on the idea of a triage system. The first step is to plan. The purpose of the planning phase of the cycle is to define the objective of your test. Prior to engaging in the test, you will want to define what specific change you will test, who will perform the test, where it is taking place, when it will occur, and what is the predicted outcome. Be sure to start small and scale up from there. Maybe you will limit the number of people involved or the time frame for the test before moving on to bigger, more elaborate testing of an intervention. For our example, your team might plan to trial a simple triage algorithm with one staff member the next day in the clinic. You'll want to identify all of the tasks that your staff should trial, like assigning triage levels to patients as they check in at the front desk. You will also want to plan a way to measure or evaluate the outcome of your triage system. For example, you may plan to measure the wait times for all of the patients that day and ask for qualitative feedback from the providers and staff about how well the triage system worked. The second step is do. This is where you implement the plan changes. Time to put your planned tasks into action. PDSAs emphasize learning from doing, so embrace a mindset of acting quickly and learning rapidly. While you are in this phase, you may decide to make some small changes to the planned tasks while in the action of doing based on feedback. Be sure to track these changes and rationale for why you made them. Going back to our example, perhaps you learn within a few patient encounters that there are some clear aspects of classifying patients that you did not have built into your triaging system, making it difficult to know where to put them in the prioritization plan. You consult with the clinic staff and clinicians on how to adjust to account for these additional patient considerations, then put these new considerations into action immediately. Make sure you have a documentation trail about these changes to be able to move into the third step of the PDSA cycle, study. In this phase, it is important to reflect on what you planned and expected to learn compared to what actually happened and what you learned. You might review direct quotes from stakeholders and specific observations your team made during the do phase, as well as graph wait times on a run chart. It may also be a good time to revisit the evidence out in the literature to help you evaluate if the changes you trialed were leading toward improvement. Reflection in the study phase can help your team determine if your actions need to be adjusted and adapted for another PDSA cycle or if there were clear reasons to abandon the changes altogether. With our example, let's say you observed that although the clinic staff felt the changes were helpful and improved their efficiency, the average wait time per patient for the day was higher than previous days. Also, some patients were frustrated by seeing other patients arrive later than them but being called back for their appointment sooner than them. The last step is to act. Based on what you learned, do you need to adapt the solution and test again? Do you need to adopt the solution for a larger test or implementation? Or, should you abandon it altogether and test another idea? Based on the example study results, your team decided that there was not enough evidence to determine if the triage system was actually causing longer wait times, and since the clinic staff seemed to value the system, it is important not to abandon it just yet. Instead, the team decides it would be valuable to provide some sort of communication to the patients in the waiting room about the triage system to help them understand what is being trialed. So, your team commits to adapt the triage system and to move into the plan phase for another PDSA cycle building off the first one, forming a PDSA ramp. In summary, remember PDSAs are small tests of change with many iterations. You start with ideas that are evidence-based whenever possible, and you test them. As you are testing, you learn and either adopt, adapt, or abandon, moving to larger tests of change until you have arrived at change that will result in improvement and is ready to implement. You can also have more than one ramp of iterative tests for different root causes or key drivers happening at the same time. Just make sure you have a system to show the iterative tests, synthesize the learning, and show the progression to show how you arrived at the solution you will implement, like this PDSA ramp worksheet. Use PDSA cycles as part of the model for improvement to see positive change in your facility.